And before I offer some closing remarks and we open this up for questions, I'd like to introduce Carrie Underwood, who's going to talk about what this means for her. Carrie?
Hello. My name is Carrie Underwood. I am from the Metro Detroit area in Michigan. I moved here just about a year ago to pursue school. I came chasing after the American dream. And I came here with a dream. I did. I came here, I wanted to go to school. I'm a biology major. And one of the things that I've been struggling with, my whole family has lately, being from Michigan, we don't have very much work. My father, he has very spotty insurance. It's been on and off. 20 years ago, he paid $1.20 an hour for his insurance. Now it's up to $9. If he's laid off for more than 3 months, it's gone. It's taken away. We have to pay out of our pocket to try and get it back. And it's been a struggle. And me personally, when I turned 18, I started having seizures. It was kind of an anomaly. Doctors really didn't know why. And to be able to afford medications, doctor's visits, hospital rides, ambulance rides, these things are incredibly expensive. You can't pay out of pocket $1,500 for a 10-minute ride in an ambulance to the hospital. I see neighbors, friends, family, people that go uninsured in this country every day, and they have no options. They have nothing. A close friend of mine passed away recently from cancer. My grandfather also has the same form of cancer, lung cancer, and it spread to this man's esophagus. He had no insurance, he had no options, nowhere to turn, and unfortunately he has passed away. No, I do feel that an exchange would benefit the people of this state. We need options, we need a way to get out. You shouldn't have to be afraid when you get sick. Thank you.
So again, thank you for being here this morning. My name is Nickie. I'm the representative from House District 13. I would like to commend my colleagues, Senator Michael Skindell and Representative John Carney and I'm proud to join them in bringing forth this legislation to create the exchanges that we need to bring this health care options to the people of Ohio. We need to create the infrastructure to be able to move ahead with our health exchange programs. Representative Carney and I will introduce today the companion legislation in the House to that introduced by Senator Skindell this past week to create the Ohio Health Benefit Exchange Agency and to establish the Ohio Health Benefit Exchange Program. We must be proactive. As you've heard from Carrie, time is running out both for the state of Ohio and the people of Ohio. They need answers, they need options today. We can't leave this to the federal government to make these decisions for us. This legislation to create the Ohio Exchange, I think, is exactly what the doctor ordered for the people of Ohio. They want options. They have told us this past year they need options, they want options when it comes to accessing health care. It's important we move forward sooner than later to implement these programs, and I'm proud to be a part of this initiative. I thank you all for coming, and we're open for questions.
It will be decided by the Supreme Court whether Issue 3 will affect the federal law. But the supporters of Issue 3 have talked about suing the state to prevent it from taking actions to implement the law. First, can you address, you're a lawyer, can you address what the chances are of that in the courts, and could you also talk about what would happen if that creates more delays?
Sure. Well, first of all, we've obviously gotten a difference of opinion amongst federal courts that are determining this issue. And as you indicate, at some point the Supreme Court will make a determination with respect to whether or not to uphold the entire law, whether or not to uphold parts of the law, but we don't have a crystal ball to determine what, in fact, they will do. It is not in the best interest of the people of Ohio for us to sit and wait to see what that outcome is. What we do know is if we fail to act now and the Supreme Court holds up all or parts of the law, we could be in a position where if we fail to act and we fail to take appropriate planning steps, that our only option is for the federal government to come in and set up the health exchange for Ohioans. Now, the healthcare community in Ohio, of which I am part, I've been a healthcare attorney for more than a decade. I set up physician practices and do the business work for doctors. We appreciate that it is in our best interest to make sure that it's Ohioans who are setting up the health insurance exchange, that are providing the greatest options through insurance products, that our insurance brokers in the state and agents in the state are able to participate as navigators in the system. So we believe there's already bipartisan support for an Ohio-specific exchange. Now, there's a lot of other issues going on here with respect to whether or not this is a political issue that is going to be helpful in an election that's coming up in November. But from our perspective as individuals who are being paid by taxpayers, when you look at the administration being paid by taxpayers, their best interest is represented in us being in the best position to pursue whatever option is available after that Supreme Court case comes out. And so we need to take necessary steps to be in the position to put our own exchange in place should in fact the Supreme Court come forward and say health exchanges are going to in fact move forward in all states, and those states that have taken appropriate steps to put them in place now have the options to run their own, as opposed to sitting on our hands, waiting, and then putting ourselves in the position where we have no option.
But aside from the federal issue, does any action that the state takes to implement the law violate issue 3?
I think that certainly there are open questions with respect to what the impact of issue 3 are. And given the fact that I'm not a seated judge and this isn't in front of me, I'm not going to weigh in ultimately on where the courts will decide. But, you know, the Supremacy Clause of the federal Constitution says that the federal government can, in fact, decide to preempt the field, and that is, in fact, what's happening here. The federal government has made the determination that, with respect to health care, they are going to govern the implementation of health care across the country specific to these health exchanges. And so the Supremacy Clause is pretty well-founded law at this point. I mean, there is a number of cases that indicate that should the federal Congress decide that they want to regulate a field, they have the ability to do that. And so all of us who are legislators, the governor, the lieutenant governor, have sworn an oath to the federal Constitution. And so it is our duty to abide by what that federal Constitution is. And the Supremacy Clause says if the federal government should determine that, in fact, they're going to impose specific regulations on states, that we are duty-bound to follow it. And I think that's, in fact, what's happening here.
Is there any way you can force Mary Taylor to come and testify? Were you talking before about a subpoena in some way? Can you do that just by yourself, or is that you really need Republicans to control the legislature to do that? Where are we at?
Yeah. So in the Health Committee, I made a motion to subpoena Director Taylor, seconded by Representative Hagan. All the Democrats on the committee voted in favor of that motion. All the Republicans voted against it. So at this point, unless some of my Republican colleagues decide that Director Taylor needs to come forward and testify, they're not going to compel her. Now, that being said, the governor has indicated as recently as a month ago that he is open to providing someone to come and give testimony to the legislature with respect to what progress has been made. Now, he mentioned both Director Taylor as well as Greg Moody. I'm fine with whomever the governor wants to send. But at the end of the day, we need to be working on this. I mean, the time for playing politics is over. It's time to actually get to work. And I think that the public is clear that they want their elected representatives, that they want their executive agency heads to actually working on getting things done. And so I look forward to whomever the governor sends, whether it's him or one of the folks on his cabinet, to participate in the interested party conversations and actually come to some sort of bipartisan solution on how we fashion this exchange.
Who would be